Hello, good afternoon, everyone. And thank you very much for joining us in this live stream, where we are going to introduce to you our brand new master's program in global health. So you will be hearing from colleagues who will be involved in the teaching on this course, and they will share with you their experience and their own research in areas relating to global health and how this is embedded into the teaching and the learning on the program. So please leave us any questions that you need to ask in the comments, and then we will deal with that when we come to the question and answer segment. So first, I would like to start with a round of introductions of the people who you are going to meet today. So I will start with myself, and I am Dr. Abdulmidia, and I came from a veterinary background. I am a senior lecturer in molecular microbiology here at De Montfort University, and my research interest is mostly on One Health in general, which is a major component of global health and in sustainable molecular diagnostics for infectious diseases. If I can have my slide, please. So I just want to talk to you briefly about One Health. So One Health is actually is a concept that has become a movement, and the world is really changing. So the human population is growing. There's about 93 million per year. So this will increase the chances of contact with animals. It increases the chances for diseases as well. So climate change and use of land is another contributing factor, and where the human activity actually is using the land, and then this again makes the animals more prone to disease. So here, what I want to mention that it's a multidisciplinary collaboration that involves physicians, involves veterinarians. So I came from a veterinary background, involves health practitioners, social scientists, as you will see in this global health program, and other developers in other sectors as well. And the aim is to improve the health and well-being of the humans. So I would like to move next to Kathleen, and please, Kathleen.
Okay, hello, I'm Kathleen. I'm the program lead for the MSc in Global Health. I currently teach on the undergraduate course, Health and Wellbeing in Society, and I have a practitioner background. I'm an occupational therapist by background, with over 20 years experience working in mental health in a variety of different backgrounds.
Thanks, Kathleen. And we move to Tina.
Hello, everyone. I'm Tina van Bortel. I am a professor of global health here at De Montfort University. My background is quite multidisciplinary, actually. I started off in the health humanities, and then I moved on to social sciences and health, sustainability and health, and then into global mental health. So you could say that I'm a bit of a generalist, if you like, looking at mental health also as a specialization. I have worked in global health and global health related fields for almost 20 years, and I'm tremendously excited to work with a fantastic team on the MSc of Global Health at De Montfort University. My involvement in the MSc is going to be cross-cutting, looking specifically at determinants of health and at global mental health and well-being, which I'll come to later on in this presentation.
Thanks, Tina. And now we will move to my colleague, Maria.
Hi, my name is Maria. I'm a senior lecturer here at De Montfort University. I am a social and cultural anthropologist, and I bring over 10 years of experience to the program.
Thanks, Maria. And we'll move finally to Parvis. Yes, Parvis, I think you're muted. Yes.
Hello, everyone. I'm Parvez Haris. I'm professor of biomedical science, and my research is very interdisciplinary, focusing on major global health challenges, including the problem with clean water, issues related to diet and nutrition. So it involves looking at elements and small molecules to whole organisms. So today I will describe something about some of the research that we are doing. Thank you.
Okay, thank you everyone. And let's just move to Kathleen to talk to you briefly about the course. Welcome,
Okay.
Kathleen, again.
Okay, thank you, Bakri. So can I have the first slide, please? Okay, so welcome to the course, everyone. I'm absolutely delighted to be able to tell you all about this multidisciplinary, interdisciplinary course that we've developed. Our vision for the course is that our graduates will come out of the course confident, able to identify a range of different factors impacting on global health, but not only that, that they're able to work together in teams across different disciplines to enable them to address some of the key global health issues, both locally, globally and nationally. We have a range of different modules that you can see on the slide. So we have the Introduction to Global Health, which actually sets the scene for the whole of the course and enables students to get that background understanding around global health. So they understand about the actors, the structures, the economic systems, and the factors that contribute very widely and broadly around global health. And then students move on to look at research in global health. And this module will enable students to develop some skills and capacities in conducting global health research. So they'll learn all about different types of research, how we work together across disciplines to carry out research in global health. And they will also then develop a research proposal, which will then lead on to become their global health dissertation. We then move into the global health skills module, which I'm going to be leading on. And this is a module where students will have an opportunity to reflect on their skills. They will have an opportunity to learn about things like cultural competence, different styles of leadership and management that are actually used across kind of different global health contexts, and how we need to be reflecting all the time in terms of the approaches we use to engage different communities. We'll look at health literacy and a range of other skills as well. And then we move on to critical issues in global health. And Maria, who you've met earlier, she's going to be leading on that module. And this gives students an opportunity to look at global health within specific contexts. So students will have an opportunity to look at things like, for example, sickle cell anemia, within Sierra Leone. They could look at sort of the issues around poverty, in different contexts, and a wide variety of other global health issues within particular contexts. And then we move on to look at the global health dissertation. And what I wanted to emphasize here is that the course that we created, we wanted to give people a different, lots of options and choices to make this MSc as relevant and interesting for them as possible. So what we've done within the global health dissertation in particular is we've created different options for students to demonstrate learning outcomes. So students, as well as recapping and learning about the different types of research and taking their research forward, is they'll have an opportunity to either do something like a systematic review, or they could actually do something like a poster and an article for publication, or they can do like a traditional dissertation, bringing together research. So we want to make this as relevant as possible, very much focused on some of the key employability skills that are used within this as well. And as I say, it's been developed extensively, this kind of vision for the graduate that we're sort of hoping for, and to give people an opportunity to develop towards, by sort of collaboration with employers, researchers, people in the field here, and globally as well. Now, alongside the modules, all of which are 30 credits apart from the Global Health dissertation, we've also got additional learning opportunities. So we're going to be continuing to work, as we do normally on other courses as well, with DMU Local, who provide volunteering opportunities. And at the moment, they're actually developing capacity building modules and opportunities for students to work with communities, to make a difference and engage with different communities. We're also going to be sort of working closely with careers and employability as well, so that, you know, that students, if they want to, if they choose to, they can perhaps have a placement if that opportunity is available. Obviously, COVID permitting, you know, in terms of the restrictions. So this is what we're sort of aiming for. This kind of interdisciplinary course. We want to attract international students, home students. There's a part-time and a full-time option as well. There are sort of the alumni scholarship is also available for students. And there are also some scholarships which are for international students as well. So do have a look at those, which we'll make available to you on the web pages as well. So can we have the next slide, please? Okay, so we have developed a range of different assessments, and many of these, again, are based around key employability skills. So in developing the course, we've really looked at what employers want, what employers need, what do people within global health contexts need, you know, from our graduates. So that's why we've got a broad array of assessments. So we've got reports and essays. We've got research proposal, which I mentioned before. We've also got group and individual presentations, again, acknowledging that sort of verbal and presentation communication skills are really, really important in these different contexts. And also within that, we've got this kind of the group podcast that we're going to ask students to develop based around a global health issue, again, to bring in those digital literacy kind of skills, which we've seen so much in, particularly in this current pandemic that we're living within. That's very important. So reflection is going to be a key part as well, the community health profile and the dissertation, all of these range of assessments to give people array of different sort of possibilities to show and demonstrate their different skills. Can we have the next slide, please? So there's a number of different sort of career and employability routes. This is not a clinical MSc. It's not like social work or nursing or anything like that. It's looking at sort of global health in its broadest context. You know, so the underlying skills and competencies we've spoken about already in terms of research, practice, reflection, and understanding those key issues, give students those transferable skills to work in these different types of careers and employability areas that we've actually got mentioned here. So those may include policy, advocacy, some kind of global health education, research, engagement, which is really important in terms of engaging with diverse communities, working in health forums, campaigning, health promotion, humanitarian roles, and other trainee schemes as well. So there's plenty more that we can talk about. There'll be time for questions afterwards, and I'll be happy to answer any questions that you have. Thank you.
Okay, thank you, Kathleen, for the useful information. So now we are going to move to hear from Tina, and then Maria, and then Parvis, and they are all active researchers in global health in general here at Leicester School of Allied Health Sciences at De Montfort University. And they have various research activities which are quite interdisciplinary as well, ranging from mental health to environmental science and illnesses. So we will start with Tina.
Thank you very much, Bakri. Could I have my first slide, please? So yes, this is a picture that you might not have immediately expected, I suppose, but I actually, for part of my childhood, grew up in the Democratic Republic of Congo, in the area called Kasongo in the Kivu region. My mother and father were medical aid workers there, and so you can see that from a very early age, I already had an interest and exposure to different experiences and to the wider, what we call, determinants of health. Could I have the next slide, please? So that sparked my interest in global health, and specifically, as I mentioned in my previous introduction, to the determinants of health and the drivers of our health. And the drivers of our health and well-being are very complex, interconnected, and interdependent, as Bakri said as well earlier on. We need to draw on both specialists and generalists from multiple disciplines and multiple sectors to address complex global challenges. We can't do that alone. We can't do that in silo. We don't live in silos. So partnerships are key, as Kathleen pointed out as well. So we need to partner with key stakeholders and communities to understand issues in and across contexts, and also to co-create sustainable integrated solutions. And when we look at the current pandemic, as Kathleen and Bakri have mentioned as well, and we will hear a bit later some other examples around this, we can definitely see how these interconnectedness and interdependentness plays out when we look at rapid globalization, urbanization, population growth that's out of control, and a disregard for our environment. It's creating a breeding ground for pandemics, basically, zoonotic diseases. And we see that obviously, we have seen that already with Ebola and some other conditions and illnesses. And we see that now in our pandemic as well. And that has a knock-on effect on many other things, including on mental health. Could I have the next slide, please? So mental health, as I said, and particularly the determinants of mental health, well-being and healthy life courses, is my specialist area. And global mental health is actually a relatively new discipline. It's been developing over the past 10, 15 years in recognition of mental health being a major global challenge on the global agenda. And it's been taking off as a global priority area with, for instance, the World Health Organization, the World Economic Forum, the World Bank, and also the UN Sustainable Development Goals, all advocated good mental health and well-being for all as a crucial part of health, because there's no health without mental health, and also we can't talk about health without looking at the determinants of health. And to point out in terms of the Sustainable Development Goals, mental health and well-being was not included in the Millennium Development Goals. This is the first time that it's included in that UN agenda, so that's a major achievement, but it's also a reflection on the major global challenge on mental health we have. So mental health is currently also referred to, unfortunately, as the other pandemic, other than the coronavirus pandemic, because what we see, and I'm working on a few international studies and a UK study as well, is that mental health issues are on the rise in relation to the coronavirus pandemic and the restrictions that has placed on us. For instance, there is more mental health issues because people are fearing, have fear because of the virus, fear for losing their jobs, their livelihoods essentially. They are isolated because of lockdowns. They have lost loved ones, and they might have lost also hope for the future, particularly in the younger generation. We are currently seeing that. And we also see that existing inequalities are being exacerbated in this pandemic, including in mental health. So if you think even about lockdown and working from home, if you have a house with access to green space and you have adequate housing, that might be not so much of an issue. In fact, it might actually play to your benefit. But if you live in a tiny flat with a family with several children, for instance, you have no access to green spaces, you might have damp housing conditions, not good IT access, or not have the IT facilities, for instance, then it's actually completely detrimental to your health and to your mental health. You will also lack in your education, and you might even lose your job. So there are signs that there is a growing mental health epidemic or even pandemic looming. Could I have the next slide, please? I've been extremely fortunate to work on some fantastic global health projects with wonderful partners around the world. And this is just one example of a program called Aspen and Indigo. Aspen is the European counterpart of Indigo. Both programs looked at stigma and discrimination of people with mental health problems, more specifically depression, in 40 sites in 35 countries around the world. And these global partnerships have taught me an awful lot about working in context and across contexts, and about the determinants of health as well. And if I could have the next slide, I'll point out 2 opportunities with global partners as well. First of all, a partnership we have with fantastic colleagues in Sri Lanka at the IRD, the Institute for Research and Development in Health and Social Care. And on the back of that 40-site program, we developed our partnership with placement opportunities, and we also developed an annual qualitative research capacity building course, because a lot of the health professionals and health researchers in that particular context looked more at health and at mental health and the determinants of health from a quantitative point of view, but not so much from a qualitative point of view. And to have multiple disciplines, as we said, and multiple ways of researching is really important. So we have a very fruitful and very exciting capacity building course running there, and placement opportunities and research activities as well. And then another opportunity with colleagues in India. On the next slide, please. Again, these are fantastic, wonderful colleagues at InMind, which is the Institute for Mind and Brain in Kerala, and Open Mind, a research training and advocacy center in Kerala, again, where there are placement opportunities. And on the next slide, I will introduce you to a couple of projects we have been running over the past few years. So 3 years ago, we had an inauguration of the Kerala Mental Health Research Network we set up in the state of Kerala in India, where we held a mental health priority setting exercise. This was an interactive workshop with all key stakeholder groups within that mental health system, within that context. And it was really fun, really exciting. And what came out of it were some key priority areas and opportunities to take forward, such as, for instance, the suicide prevention program and the online training linked to that, which we are currently running, and we are going to build on that as well. And then also the Health Awas, or the Health Voice project, looking at the determinants of our healthy lifestyles and well-being. We did that with doctors, with students, and also in a population cohort in one particular municipality. And again, there are fantastic placement opportunities here as well. So these are just a few examples to point out what kind of projects within mental health and the determinants of health we are conducting, and where there might be placement opportunities as well. And I'm very happy there are many more examples I can give to answer any questions in the Q&A later on. Thank you.
Thank you, Tina. That's really great and interesting, and quite adventurous as well. Let's move to Maria and see what adventures she had also in Africa as well. Thank you.
Thank you, Bakari. Can I have my first slide, please? So my name is Dr. Maria Bergs. As I said earlier, I'm a social and cultural anthropologist, and I work at DMU at a unit for the social study of thalassemia and sickle cell. And those are inherited genetic conditions that affect millions of people worldwide. So my research is very concentrated on these specific conditions, but is very much a global research focus. As well as focusing on those 2 specific conditions, I also have a broader background in disability. So you can see that I studied in Sierra Leone. I did my PhD there, and I have growing engagement with the country, and I work there with students there, universities, with the health sector and so on. And I work a lot in African issues, but I also work in a global context on disability. So I'm very much bringing kind of global of research to the program. Can I have the second slide? Great. Can I have the second? Okay, wonderful. So at our unit, we focus on global health research in Brazil, in Nigeria, in Sierra Leone, of course, from our own expertise started, but also in the United Kingdom. And we have partners in all those countries. And we very much have a holistic approach. This is on the impact across the life course. So on reproductive decisions, on genetic education and employment. So you have the breadth and depth of the research. Okay, they're telling me there's a little bit of delay. I'm very sorry about that in terms of the YouTube. But there's very much a breadth and depth of research there. And you see the social determinants of health as well as the UN Sustainable Development Goals. For example, the third goal on health, but also, the goal on gender and the eighth goal on employment. And we do research that really aims to empower and improve the quality of life together with people in a culturally sensitive way. Of global public health, disability, chronic illness, and genetics. And we also address global health challenges such as the pandemic response, humanitarian aid, and life after conflict. So teaching is very research.
Yes, apologies for the technical glitch. Okay, thank you, Maria. Thank you very much. And we will move to Parvis again, talking about another sustainable development goal. And this time it's completely different experience. So water. Thank you, Parvis.
Thanks very much indeed. And can I have the first slide, please? So it was nice listening to the presentations by my colleagues. And now I'm going to discuss something slightly different. And that is actually looking at the problem of water. And one of the issues that we really been looking at over a number of years is the problem of arsenic contamination of groundwater in Bangladesh, which has been described as the largest mass poisoning of a population in history, and much bigger than anything that we have seen, because millions of people actually have been affected by exposure to arsenic in their drinking water. So the drinking water, as you can see from this slide here, comes from these tube wells that were installed, but unfortunately the content of arsenic in these water were not initially properly analyzed or investigated, and so people have been drinking arsenic contaminated water for many years, several decades, and that has really led to huge problems in human health. What we are engaged in is interdisciplinary research, because any problem that involves human beings actually is highly interdisciplinary, because there are so many aspects to it, so many different dimensions to it. As you can see from here, you can actually see a slide that has been produced by one of my PhD students, and you can see when you look at the environment, there are so many different aspects to it. So you have the groundwater here, you have the crops that the animals feed on, and these animals and plants are consumed by human beings, which in turn will get exposed to chemicals that might be present in the water or in the soil. So there is air pollution issues as well from natural sources such as volcanoes or from industrial activity which human beings inhale. So human beings get exposed to a lot of different chemicals that are in the environment, and this can actually have harmful effects. And arsenic is one of those highly toxic elements that actually has been a big problem in certain parts of the world, especially Bangladesh, where millions of people have been affected. So what we have been trying to do is try and find ways of addressing this problem, because it really needs an integrated approach. As you can see from this slide, you have the environmental issues, You have then exposure issues when the individual gets exposed, and then there is a societal and political and decision-making processes, policy making, and so on. So global health is an extremely complex interdisciplinary research field, and it's also very exciting because you do get a chance to work with different people with different expertise, and that actually makes it a very fascinating field of research. So our research has been to focus on addressing the human exposure to arsenic from drinking water in Bangladesh, and also addressing the exposure to arsenic and other toxic elements from foods such as rice, because rice is the staple diet of the Bangladeshi population. And you see, rice is obviously grown in fields that and they need water for cultivation, and if there is a lot of arsenic in the water, then the arsenic will enter the rice, and then human beings will get exposed to high amounts of arsenic by eating rice. And this is actually taken from the front cover of a article that of a journal where we published an article, and this actually is our own pictures showing how people are cultivating rice. The rice consumption is very high in Bangladesh, and therefore we've been trying to find ways of addressing the problem of arsenic exposure from water and arsenic exposure from foods. Next slide, please. So in the next slide, you can see that the United Nations Sustainable Development Goals identifies water as a major issue, as a major global health issue, and as a major global challenge that needs to be resolved. And if you look at this side of this slide, you can see here that billions of people still lack access to water and sanitation services. It's one of the Sustainable Development Goals, number 6. And you can see a lot of people before the COVID-19 crisis actually still lack water, basic water for sanitation and hygiene and so on. And the COVID-19 implications are even more scary, because if you look at it, there is lack of basic hand washing facilities at home, and so there is a huge problem of water around the world. And COVID-19 crisis has actually made it very clear to us that we are faced with huge issues that needs to be solved, and water is one of the major issues because it impacts on so many aspects of life. It underpins nutrition, diet, gender equality, and so many different other aspects. Life on the ground, life under the water. So there are so many aspects that water is connected to, that's something we cannot at all ignore. And I think COVID-19 has actually brought this into more focus, and we are doing some work to address this problem. And in the next slide, I will show you some work that we've been doing. And this is some work related to using a plant. So this is using plant as a technological device, because this plant is called the water hyacinth plant. The water hyacinth plant, as you can see here, is the plant that is considered to be the fastest growing aquatic plant in the world. It has long roots. So it's considered to be a weed, and it's considered sometimes to be a green plague. It doubles its population in 2 weeks. And it's a costly plant in terms of the fact that 50 million tons of the water hyacinth plant are removed from the White Nile annually, and that costs millions of dollars that are spent on this aspect of controlling the water hyacinth. So we thought, how can we use this plant in an effective way, in an imaginative way, so that we can actually make a good use of this plant for improving the environment, especially focusing on improving water quality. So what we did was to take this plant, and we did different types of experiment in the bench and in situ in the river, looking at the performance of this plant to remove arsenic and other highly toxic pollutants from water. And we managed to show from our studies, and if you are interested, you can find the links to our studies here, how we have managed to use this plant to remove highly toxic chemicals from water. And this is another slide showing how this plant can remove up to 95% of arsenic from water very quickly and very rapidly. So if you are interested, you can go and read some of our articles. So this is an example of how we can use a plant that is available in nature in plentiful supply, considered to be a weed. And if you have some imaginative ideas, you can turn this plant into an effective technology for purifying and providing clean water to people around the world. And we are actually working on the ground, trying to improve water quality. And we have done some work with a river in Wales which is a highly polluted river, and we managed to use the water hyacinth plant, and we've shown that in a pilot study that actually the water hyacinth plant can take up highly toxic elements, including cadmium, lead, mercury, zinc, arsenic, and so on, very efficiently and very quickly. So there is great potential, and what we now need to do is to extend these studies and go and do analysis and studies in places where there are huge environmental problems, such as in Bangladesh. So you can clearly see that at De Montfort University, we have highly interdisciplinary research addressing major global health crisis issues such as water pollution, food, diet, and nutrition, so that we can help address some real problems on the ground that affects some of the poorest people in the world, as a matter of fact. So with this, I would like to thank you for your attention.
Thank you, Parvez. That's really, really interesting. And I'm sure many people will be interested to follow up on this as well. So I'll just bring you briefly now to the program lead, Kathleen, again, for some concluding remarks before we move on to the next part.
Okay, so we're aware that Maria had some problems with the internet. So I just wanted to summarize some of the things that I know that Maria was going to talk about today. So as we've said so far, and what you can see running through as a theme, is this sort of emphasis on the Sustainable Development Goals. And that's what Maria was going to speak about when she was doing her presentation, that her module and her kind of expertise, her research experience, her practitioner experience, of work in a global health context, she's going to contribute all of that into the critical skills module. So she's particularly done a lot of research around, obviously, sickle cell disability. She's looked a lot at sort of issues around people shielding, how disability is perceived, you know, the stigma and issues around kind of ableism and things like that. So she's also looked at, you know, sort of, she's worked a lot in terms of interdisciplinary research. So again, she's going to bring that into the critical issues module to really sort of make that a really interesting module for everyone. And one of the things I wanted to say from all the different modules as well is that we're going to embed, if we can, some global health content as well in terms of global health from DMU Global. So at the moment, obviously, there are some restrictions around this, but we hope that that will open up in due course. And that there may be opportunities in the future. But if not, we're still going to include some DMU Global input, even if it's virtually, because we've been doing some fantastic work. We've got connections with lots of different areas across the globe where we can initially make some of those connections to have those really good kind of interdisciplinary sort of discussions and research. Okay, so I'm going to hand back now to Bakri. So thank you, everyone.
Thank you, Kathleen. Thanks for the summary. And as you've seen, there's quite a lot of a host of research, interdisciplinary research that all comes into global health, and there is more than that. Actually, it's just the time is quite short for talking about global health, because we need days to talk about global health. So now we're going to spend the remaining time on answering the questions. So if you have a question there, we are happy to take your questions forward. And we are here. I just want to welcome Amr, and Amr works in the international office, and he will be able to assist with any questions relating to international students. So welcome, Amr.
Thank you, Dr. Abu Bakr, and thank you, everyone.
Okay. So can we have the first question, please? Okay, so the first question is, what support will be available for international students studying on this course? So there'll be lots and lots of support. All of the people teaching on the courses and leading the modules are very experienced tutors. And what I should also say as well is that we're part of a bigger, wider school of really experienced researchers, practitioners, and also educators. And everybody comes from this kind of DMU ethos where we're very keen on the students doing the best that they can and supporting our students to reach their potential. So we'll have a really good induction program in place. Obviously, people that are from international students, they'll be getting used to maybe, you know, living in Leicester and things like that. And we'll be helping them to settle in. Everyone will have a personal tutor. And we'll also have, as part of our induction, a lot of emphasis on transitioning onto the course. So that could be for international students, to help them in terms of their transitions, to reach their potential and be supported. But also, in addition to that, it could be people in the workplace who maybe been out of studies for a while, who may need some support, you know, to feel confident to get back into academic work and so on. And there'll be lots of kind of support in terms of connecting with the wider supports that are there and are fantastic around the core, you know, sort of DMU at the moment. So we've got support through the library services, we've got counselling support, welfare support, and all of us teaching on the course have done sort of personal tutor training, and we're very passionate about supporting our students and giving them the best possible opportunities that are available for them. Okay, would anybody like to add to that, or should we go to the next question? Yeah.
All good, Kathleen, all good. Thank you very much.
Okay, all right, no problem. Can we go to the next question? Is this course registered with the UK professional body? It isn't actually registered with the UK professional body. In the future, we are looking to develop some kind of accreditation as part of the development of the course. But at the moment, no, it's not a part of a UK professional body. So I should emphasise that it's sort of global health in its broadest context, looking at the sustainable development goals, the kind of interdisciplinary partnerships and working to look at sustainable solutions. But it's not a clinical or professionally based course like nursing, social work, or occupational therapy. Okay. Can any medical graduate with 5 years of graduate study join in? What are the future prospects for them? Okay, so what we're asking for in terms of admissions criteria is that our students have at least a 2-2 in terms of a degree classification or equivalent. However, we're very well. Obviously, a medical graduate is going to have more than that as well, and definitely they could apply if they wanted to. Now, there's a number of different sort of future prospects potentially for people coming onto the course, whether it be a medical graduate or otherwise. And I talked a bit about those before. So it could be about working sort of locally with diverse communities. I think that, you know, from what we've heard from the different discussions, there's scope to work in so many different contexts. And the pandemic also offers opportunities both now and into the future of other areas that might be possible to work in terms of looking at sort of inequalities, looking at sort of social justice issues, evaluation of policies, and a wide variety of other things that I've talked about so far. So certainly a medical graduate would definitely be able to apply. What we're looking for are people who've got that passion to work in this area of global health, who want to work in teams, who want to make that difference, who want to form those partnerships and be creative and use kind of research and practice as well. Okay, can we come to the next question, please? So are there automatic scholarships for international students applying for the course of September intake? Okay, so there are a number of different scholarships, and I think the best thing to do is for us to signpost you to our web pages to tell you a little bit more about those scholarships. So there's an EU transitional scholarship that's available. Again, if you refer to our webpage, you'll be able to see that. There are international scholarships which are on a first come, first served basis, which you can look into. Again, these are on our web pages. And also there's an early payment opportunity whereby if you pay early, you get £500 off.
If I may add, Kathleen, thank you very much for this. Yeah, as Kathleen mentioned, so for international students especially, it's first come, first served. So if you pay the deposit, which is £4,000 before the deadline, we will offer, if the availability of the scholarship, 1,500 plus 500. So in total, it will be 2,500 according to the scholarship. There are other scholarships, like Kathleen mentioned. Please refer to them on the website. And we also have the Equality, Diversity, and Inclusion scholarship. It's competitive, so you will need to apply, and there will be a panel, and they will review and announce the winner. And we have also the Sustainability Scholarship. Please, if you have any more questions, do not hesitate to get in touch. Thanks, Kathleen.
Okay, thank you. So the next question is, when does the course run from? September to April? Bakri, would you like to answer this one as the Deputy Programme Lead?
Thank you. Normally courses, master's courses, they run longer than standard undergraduate courses because you have a project to do. So you will finish around August time, July-August time in the subsequent in the following year. So it's not September to April. September to April is mainly for undergraduate courses.
Okay, can I just add to that? Sorry, can I add to that as well to say that we've got to remind you we've got the part-time and the full-time route as well for this course. So we've got another question here. How would placement opportunities fit alongside the academic aspect of the course? Okay, so the placement opportunities that we've been looking into to sort of, to complement the program would just run alongside that. And we've been working with DMU Local, who offer a range of different placement opportunities, which are fairly flexible. So they range from sort of shorter sort of volunteering opportunities within sort of community settings around Leicester, or longer ones. So they have a range of different sort of opportunities there. So what we've done is we run that alongside the course for you to do at your leisure and around your other work and commitments and home commitments and so on, so that you can sort of do that at the beginning of the course if you want to, or at a time that suits you. But what we're planning on is that during induction, we're going to be having a session all about volunteering and placement opportunities, which we hope will be opening up, obviously, as restrictions are lifted. Okay, have we got another question? Please, when is the start date for this program? Bakri, would you like to answer this one?
Yes, the anticipated start date is October 2021. So people join from the last week in September as induction week, and then beginning of October, that's start date 2021.
Okay, thank you. Thank you, Bakri. How many students will there be in each class? Okay, so what we're aiming for, Ollie, is we're aiming at the moment to have about sort of, a fairly small group to kind of begin with. Okay, so we're looking at sort of about 20 to begin with, 20 students, and these will be a mixture of home and international students. And as I said before, we're hoping to attract people who come from sort of different workplaces. So they could come from charities, NGOs, or different sort of relevant backgrounds, but also our graduate students and also international students as well. And what we're hoping for is a kind of those rich learning opportunities of students being able to share with each other their learning and share their experiences from their contexts and so on. So there should be about 20 is what we're aiming for, Ollie. Okay, thank you. Next question. Do you accept international students for postgraduate diploma global health? If yes, what's the entry criteria? Would a third class BSc in sciences qualify for the postgraduate diploma? Okay, what I'd advise you to do, in terms of this query, is to contact admissions. So we can and you can also talk to us in detail about this as well. What we're looking for generally is a 2-2 or equivalent. However, what we're sort of looking at is sort of those broader based experiences as well. So we want to give people sort of those different opportunities, and we'll look at each application obviously based upon its merits. So find out a little bit more from admissions, and obviously that link will be available to you. But bear in mind that if you've got sort of other experiences, that might actually sort of help you as well in regard to this. Okay, can we have the next question? Are any of the placement opportunities paid? At the moment, the ones that we're looking at are more volunteering. However, there wouldn't be anything to stop you actually looking for some work. If you've got sort of that ability to do that whilst you're actually on the course. But at the moment, they are volunteering opportunities that we're looking at, because again, they give a bit more flexibility. Which organisations can you work for with this qualification? Bakri and maybe Tina, would you like to contribute here?
I'll give it to Tina first. Yeah.
Tina?
Thank you, Bakri. Yes, absolutely. And I think part of that question, Kathleen, you touched upon earlier on as well, because this is a very multidisciplinary course, interdisciplinary course that can lead to various pathways, depending actually on your background as well. For instance, I can immediately see a pathway into working with NGOs and charities in the global health related sphere of a very wide variety. Someone earlier on said that they had a medical qualification. Think about Médecins Sans Frontières, for instance, Doctors Without Borders, and many, many more, CARE International, and I can think of many, many. Of course, as Kathleen pointed out as well earlier on, you can take a policy route, for instance, because influencing policy and practice and making a strong contribution there from that wider determinants of health point of view is not only hugely important, but with a foundation in wider global health in a very applied and interdisciplinary way, as we've presented to you, would definitely help also in a policy context, for instance, or in a practitioner context, even though this is not a professional course as such. It can definitely help within a practitioner context as well. If you work in social work, for instance, as a practitioner with disadvantaged populations coming from a wide variety of different backgrounds. If you work in health, if you work in education, there are many, many paths that you can take. You can obviously also work in higher education. You can become a global health teacher, for instance, or researcher. So there are many pathways that you can choose and that you can go in. I don't know, Bakri, is there anything else you wanted to add to this?
I think that's, yes, NGO was the first thing that came to my mind as well. Maybe Parvis has something more to add as well.
It all depends on your passion and interest. There are so many different pathways that you can take depending on what you're really interested in, and what your background is. For example, international organizations such as the United Nations, the World Health Organization, I mean, huge number of governmental and non-governmental organizations require people with expertise in global health, and global health is becoming such an important subject that both private companies and industries cannot ignore global health. If they're going to produce a product, they'll have to look at how that will have a positive impact on global health. So it has a broad area of potential job positions, and I think it really depends on what you really want to do, what you really have a passion for. But I think we've covered a lot of different areas that this can lead to, including, of course, doing a PhD and then going into academia as one, if you want to. And like Tina also mentioned about going into teaching. So there is a diverse range of opportunities this degree can give you, and it all depends on your interest and determination.
Yeah, thank you. That's really good. Thank you. Do you need work experience to be able to apply for this course? Not necessarily. Although obviously work experience always helps, doesn't it, in terms of communication and team working and so on. Bakri, do you want to add to this?
In fact, it's not surprising, not just in this course, but in many other courses, master's courses. You see some who are joining after substantial work experience. So we have like a huge variation in the age of the MSc students. So some are coming straight from university, some are coming from quite a big work experience, and some actually they want to change their direction of career, for example. So this is all something that is expected, and each one has its own merit as well. So yes, we expect students with experience, we expect students without experience, we expect students with experience but not relevant experience. They want to change direction so they can move into this new field as well.
Okay, thank you. Would placements provided by DMU Local equate to the 20 hours a week students are entitled to?
So I can jump in if you don't mind me, Kathleen.
Yes, please. So, please. Yeah.
Absolutely. So thank you, Afsana from Fulbright. The idea behind each faculty that we have a placement team, we always encourage the student to go and approach them with their CV and personal statement, and hopefully they can help them with through the industrial links to apply. For international students, yes, they are allowed to do 20 hours per week as per the Home Office regulation, and hopefully after they graduate, they can apply for the post-study work visa scheme, which will grant them 2 years so they can start working full-time. I hope this answers the question.
Okay, thank you. Thank you very much. So Bakri, thank you very much for everyone for your questions. We've actually got one more coming up. We'll just finish this really quickly. Can someone with an MSc in public health take this course? Yes, absolutely. So please do, contact admissions. We'll provide all the details for you. Have a look at our webpage. I'm going to hand over to Bakri to summarize. Thank you, everyone.
Okay, thank you everyone for joining us this afternoon. It was a real pleasure, and we hope you found this informative, this session. And if you'd like to ask any further questions following today's live stream, you can email us at HLS@dmu.ac.uk as shown there as well. And you are also invited to have a look at our course website that should be on the screen. Yes. Okay. So thank you very much, and keep safe and stay well. And thank you very much from me, the Deputy Program Lead, from Kathleen, the Program Lead, and from Tina, from Parvis, from Maria, and from Vanessa, who is running the show in the background. Thank you very much.